We have a holiday here in Calcutta because today is vote.
Oh, right.
Sir, how is the situation, Bhaskar sir, in Kolkata?
Very calm and quiet.
Samendra, I think we've got the message of getting live streamed. Okay.
Yeah. Start, please.
Just let me start the recording. Just wait.
Yeah.
Calcutta because today is vote.
Right.
Yes, sir. Sir, how is the situation, Bhaskar
Yes,
sir?
start.
Okay. Shatabdi, please.
Yes.
I think we've got the message of getting live streamed.
A very good evening to all of you. Hello, I am Dr. Shatabdi. I would like to welcome all of you in this celebration at the culmination of our immunization week. We have been observing the World Immunization Week, which is the last week of April. Uh, as a celebration of the World Immunization Week, we had held a quiz for medical students. There were preliminary rounds, and it was on Kahoot and Google Form for the past 7 days. And also, we have been having 7 days, 7 vaccine quiz on the Google Form for consultants. We will be publishing facts files for 7 distinct vaccines for for the consultants in the coming days. Now, we will be focusing mainly on HPV vaccine, influenza, and Tdap today. As this is a FB live program, I would request all of our speakers to keep it simple so that the message reaches easily and nicely to all of us. And after taking blessings of Lord, I would now invite Dr. Bhaskar Pal sir, our Foxy president, to kindly give his words of blessings for this program.
Thank you, Shatabdi, for starting the program. As you know, that vaccination is very important in prevention, and the number of vaccine preventable diseases in the world is high. And India has been a success story in terms of immunization of children is concerned. But that is not something that we are discussing today. We are using this week and today's program to raise awareness among women, essentially about the HPV vaccine, which is for the prevention of cervical cancer, for the influenza vaccination in pregnancy, to decrease the risk of flu-related complications if it happens in pregnancy, and thirdly, the importance of tetanus, diphtheria, and pertussis vaccination in pregnancy. And this is essentially to reduce the load of disease of pertussis and diphtheria in the newborn. We will conduct the program in the form of 3 interviews with 3 very senior consultants who worked a lot for HPV vaccine, the Tdap vaccine, and the influenza vaccine as well. And from Foxy, we've just released a position statement on vaccination in pregnancy. But today we have with us the man of the hour, Dr. Pawan Kumar, who's the additional director in the ministry. And as you know, that this has been a landmark event that India started vaccinating young girls in the public sector with HPV vaccine. And it wouldn't have been possible without the untiring efforts and the vision of Dr. Pawan, who had to balance a limited number of dosage and ensure that everybody gets covered. So he came out with this brilliant idea that all girls within 14 to 15 will be given in the first year. And then the next year, those who enter that cohort will be given. Dr. Papan will be happy to inform you that at the present moment, the single dose is advocated till the age of 20. And since the government is vaccinating up to 15, just in a recently concluded managing committee meeting last weekend, we have decided that we'll encourage all our societies to vaccinate girls with a single dose between 15 and 20 years of age. And Foxy will reimburse the cost of the vaccine to some extent for those girls. Back to you, Shatabdi. I'm sure that this will be a very useful program today.
Thank you so much, sir. Thank you for your words of blessings. We will now move forward. As said by sir, we have 3 esteemed guest speakers today who will be interviewed by our Foxy members. We have Dr. Pawan sir, Dr. Anahita ma'am, and Dr. Krishnendu sir. So we will be taking the interviews one by one. Moving on, I would now request our Joint Secretary Foxy, Dr. Soma Datta ma'am, to kindly introduce and invite Dr. Sarita Shamsundar ma'am.
Dr. Suvarna ma'am.
Dr. Suvarna ma'am. So sorry.
May I, Dr. Shoma, Joint Secretary of Foxy, may I have the pleasure to introduce you to the Secretary General of Foxy, Dr. Subarna Khadilkar. And till Subarna Madam joins, I want to congratulate the committee chairpersons of Foxy, Dr. Manika, Dr. Sarita Samsundar, Dr. Kanchan Sharma, Dr. Asa Jain for executing this program, and they have worked very hard for this Facebook Live. Congratulations to the team. Until Dr. Subarna Khadilkar ma'am joins, let us move with the project, with this
Carry
program.
on with the program.
Yes. So thank you, Shoma ma'am. So we will wait till we will take Suvarna ma'am's blessings as and when she joins the program. I would now request my colleague, Dr. Revati Rane, to please invite Dr. Amaya Purandare sir and Dr. Rohan Palshetkar. Over to you, Revati.
Thank you, Dr. Shatabdi. First of all, it's my honor and privilege to be part of this great program. And I, as a representative of AMOX Public Awareness Committee, I want to thank Foxy, especially Dr. Bhaskar Pal sir, for association with AMOX, with different committees for this great program. We'll be sharing the Facebook Live link soon, and I hope many people will be benefited with this. For the further proceeding, I want to invite our AMOX Visionary President, Dr. Amaya Purandare sir, to share his views. Over to you, sir.
Thank you, Revati, for those kind
Yes.
words. And it gives me great pleasure to be here this evening on behalf of AMOX. I'm indeed very delighted to be a part of this very important initiative during the immunization week. Foxy and AMOX are thoroughly very, very strong partners in this fight against infectious disease, where immunization seems to be the best and the strongest weapon that we have. I'm especially acknowledging the efforts put in by the public awareness, gynecological oncology, food and drug, medical and surgical equipment, NCD, and the quiz committees of Foxy, and the public awareness committee of AMOX. And kudos to all the chairpersons of these committees for showing such a committed and spectacular curation of this very important week. Well, friends, vaccination, like I said, remains one of the most impactful tools in safeguarding the health of the nation and, more importantly, the health of women and children. And I really thank the government and people and leaders like Dr. Pavan Kumar for taking it as a priority in the national health canvas. As obstetricians and gynecologists, we know that its role in pregnancy and beyond is increasingly significant. And therefore, I appeal to all Foxians that we must guide our patients correctly, counsel them appropriately, and build trust around immunization. We can do this by strengthening awareness and ensuring timely vaccine uptake, which can make a meaningful difference in maternal and neonatal outcomes. Today, we are going to focus on three important vaccines which will and have changed the landmark, the canvas of disease in modern day India, namely the HPV vaccine, the influenza vaccine, and the Tdap vaccine. Last but not the least, I am extremely happy that experts like Dr. Anaita Chavan, Dr. Krishnendu Gupta, and Dr. Rija Batla are coming together to encourage colleagues like us to actively participate, engage, and carry these learnings into day-to-day practice. Of course, all this would not have been possible without the drive, motivation, inspiration, and encouragement by our visionary Foxy president, Dr. Bhaskar Pal, who has said that safety and science must go hand in hand to ensure that India as remains and continues to grow as a healthy nation. Thank you all.
Thank you, sir. Thank you for those insightful words. Now I request our Honorary Secretary of AMOX and
Suvarna Madam has joined, so can we take Madam's
yeah,
comments first?
yes, sure. Yes, ma'am.
Suvarna Ma'am, Please unmute yourself, ma'am.
Okay. Yeah. I have
Yes, ma'am.
unmuted. Am I audible now?
Yes, ma'am.
Yeah. Okay. Thank you. I think at the outset, I want to congratulate Monica for, taking the lead in this particular activity. And I'm very happy that you are celebrating the World Immunization Week, saving generations by vaccinations. Actually commend her because she has got so many Foxy committees and amongst together for this particular activity to spread our message that prevention is always better than cure. So I also congratulate the Public Awareness Committee, Gynecological Oncology Committee, Food and Drugs and Medical Equipments Committee, NCD, and quiz committees of Foxy and the Public Awareness Committee of AMOGS. I think you all are doing brilliant job of taking this message across to all those whom it matters. I see experts joining in for this particular activity. I can see Anaita, then Krishnendu and Nirja Bhatla, who will be giving their expert advice. And I must say that recently all of us have heard from government breakthrough in the immunization, and they have offered a free HPV vaccination for all women under 14 years of age. And Foxy will also join hands in vaccination of women even 14 or beyond. And we will do our best to conduct immunization across the country. I really sincerely thank all of you for having me here. And basically, this today's expert-led discussions will further empower us to translate this, whatever we discuss, that into action at the grassroots levels. And I really thank you for this great collective effort amongst all of you. Thank you once again.
Thank you, ma'am. Thank you for your presence and those encouraging words. Now I welcome Honorary Secretary of AMOGS, Dr. Rohan Palshetkar, to say few words.
Thank you so much,
Hello.
Dr. Revati, ma'am. Am I audible?
Welcome, Rohan. Yes, yes.
Yeah.
Yes.
Thank you so much. I just want to say is that all of us individually can't really reach the public health goals alone, and it always requires a collaboration. So I'm so glad that Foxy, AMOGS, all the committees involved, all the experts are coming together on this platform with the shared purpose of protecting our population through vaccination. So basically, we are the first point of contact generally for women, but even not just for the women, but also for the families and future generations. So I'm so glad that all the experts have gotten together. It's teamwork, trust, and timely action that can actually make a difference. So I think this collaboration is going to go very ahead, and with all the experts, it's going to be a brilliant thing. So thank you very much, and I wish all of you all the best.
Thank you, Rohan. Now over to Dr. Shatabdi to please go ahead with the session.
Thank you. Thank you, Dr. Revati. Heartfelt thanks once again to Suvarna ma'am, Amaya sir, and Dr. Rohan. We will now move on with the program. I would now like to request Dr. Meenu Agarwal ma'am, our Vice President of Foxy, to say a few words, please, ma'am, about the program.
Thank you, Dr. Shatabdi. Thank you, the whole team, all the chairpersons, Dr. Asha Jain, Dr. Archana Kumari, Dr. Kanchan Sharma, Dr. Monica. Monica is very, very sincere. Congratulations, Monica. Dr. Sarita Sham Sundar and Dr. Revti Rane from AMOX. So all of you are doing a wonderful job, and I'm sure this Facebook Live is going to be, sometimes patients don't want to, even though we are doing things, public sector, private sectors, they have joined hands, they want to vaccinate the girls, but the public sometimes they feel that no, we don't want the vaccination. So very important to talk to them, very important to in fact also teach their general physicians why these vaccinations are important in pregnancy, all the vaccinations and HPV vaccine for the girls. So we are very, very fortunate and honored to have the additional commissioner, Dr. Pavan, with us. One moment. And Dr. Pavan Kumar sir with us, and I'm sure with his powers or his initiatives, we will definitely, and with Foxy's support, we will definitely be able to do a good justice to the women and to the girls of the country. Thank you very much. Thank you.
Thank you, Minu ma'am, for those words of wisdom. Thank you. We will now request our Vice President Foxy, Dr. Vidya Thobi ma'am, to kindly say a few words. Vidya ma'am,
Ma'am, you need to unmute.
unmute yourself, ma'am.
Oh, I'm not audible. Okay.
Ma'am, now you're
Now,
audible, ma'am.
yes,
Okay.
ma'am. Okay. Good evening, everyone. And as a vice president and in charge of Food, Drugs, and Medical Surgical Equipment Committee in the past and now, I warmly welcome you all for this special session on Immunization Week. This week, we have observed lot many quizzes and lot many things from our Public Awareness Committee and other committees who have joined, and everyone enjoyed the quiz. I must congratulate everyone, all the committees who have joined this program, and especially the contribution of Dr. Monica and Dr. Shatabdi, as well as AMOGs have joined. And so I congratulate Dr. Ameya as well as Dr. Revti as well as Dr. Rohan Palshetkar for this. We are having so many queries, and safe, effective, and rational use of vaccine is at the core of both maternal care as well as public health. And many times, as a clinician, we are not only providers but also we are gatekeepers, which ensure that every woman receives evidence-based, quality-assured immunization at the right time. So many queries come in our when we prescribe for the vaccination about the safety and other things. So today's discussion will bring the clarity to the key vaccinations in pregnancy, HPV, Tdap, influenza, which helps us to strengthen safe practices and patients' confidence. So I encourage all of you who have joined this Facebook Live to actively engage and carry these important messages into our daily clinical practice. And if any queries are there, please write to us. I congratulate the whole team who have taken the active interest, and today they are going to interview many eminent clinicians and practitioners here. And I'm very happy that Dr. Pavan Kumar has joined this special edition of World Immunization Week, Saving Generations by Vaccination. I'm very happy to join this session. And definitely, under the leadership of Dr. Bhaskar Pal, we are moving ahead to solve many problems and see to your all the stories. And of course, I know that in many quizzes you have won the prizes. Thank you very much. Thank you again. All the best for this function. Thank you.
Thank you so much, Vidya ma'am. Thank you for the blessings. We will take Dr. Abharani ma'am, Dr. Preeti ma'am, and Dr. Anju ma'am's blessings as and when they join. We would move on with the program. I would now request Dr. Sarita Shamsundar ma'am, the chairperson of the Gynecological Oncology Committee of FOXY, to kindly introduce Dr. Pavan sir and carry on with the interview.
Good evening, everyone, and thank you so much, Dr. Bhaskar, for this initiative of the World Immunization Week to get 4 committees together. It was a pleasure working with the 4 committees with the vision and the experience of Dr. Asha Jain, Dr. Kanchan, and the enthusiasm of Dr. Monica. So it's my privilege to introduce Dr. Pavan Kumar. Thank you so much, Dr. Pavan, for joining in and sparing your valuable time. He's a seasoned public health professional with over 25 years of extensive experience in healthcare management, planning policy development and implementation at the national and state level. He's leading strategic policy-driven national efforts to achieve zero preventable maternal mortality for strengthening maternal health. And he has played a pivotal role in the development and release of several key national operational guidelines, such as optimization of postnatal care, life-saving anesthetic skills, revised comprehensive emergency obstetric and newborn care, learning resource package for nurse practitioner and midwifery, mentoring guidelines for midwifery educator and MLCU guidelines, and EPM-SMA for high-risk pregnancies. He has published and presented more than 100 research papers in prestigious national and international journals, conferences, and executed more than 30 health projects at both national and state level, contributing to India's public health landscape. And he's the recipient of more than 30 awards at national and state level, including the prestigious Excellence in Public Health Award in 2017. And he's been awarded an Ambassador for Peace for the Universal Peace Federation, an affiliated body of the United Nations Economic and Social Council in 2021. So he's presently the Additional Commissioner, Maternal Health and Immunization at the Ministry of Health and Family Welfare, Government of India. So thank you so much, Dr. Pawan, and it's a privilege to have you with us today. He's going to speak on what are the various vaccines which are given by the government of India for girls and women. Over to you, Dr. Pawan.
Okay, thank you. At the outset, I'm very thankful to the organization, Foxy, and all senior colleagues who have connected online. So, good evening, respected office bearers of senior members of Foxy, distinguished faculty colleagues, especially Dr. Sarita Samsundar, Dr. Nirja Bhatla, Dr. Bhaskar, and all vice presidents which are connected online. So it's a privilege to address this esteemed gathering on the occasion of World Immunization Week, observed from 24th of to 30th of April this month, which is ongoing. And the theme, the Protect Today, Secure Tomorrow, reflects the very essence of obstetrics and gynecological care. Every preventive action you take today, especially through immunization, protects women from all the diseases which are there prevalent in the scenario. Immunization today is no longer limited to child health, and it's a life course intervention spanning adolescent, pregnancy, adulthood, and healthy aging. India's universal immunization program is the largest, biggest public health intervention, not in the India, not in Southeast Asia. It's in the biggest public health intervention in the world itself. Why I'm saying so? The cohort which we manage, we have a cohort of 2.9 to 3 crores pregnant women every year where they get a TD vaccine. Then we have a cohort of almost 2.5 to 2.6 crore infants who get 11 vaccines against 12 vaccine preventable disease. We have almost conducting 1.3 to 1.4 crore immunization sessions every year in the country. And we have a very huge network of cold chain points, more than 30,000. It has been seen globally that vaccines, they have saved more than 150 million lives in the last 5 decades and contribute to a nearly 40% improvement in infant survival in the country itself and the world also. India's achievement from polio elimination to maternal and neonatal tetanus elimination demonstrates what sustained immunization can achieve. And I'm happy to say that full immunization coverage of country is almost 98% as of now. Yet there are some disease outbreaks, some cases of measles, they are happening, diphtheria and pertussis, they are happening, which have consequences on the infants and the newborns in the country itself. So despite of this high full immunization coverage, some pockets of zero dose, under-immunized children in hard-to-reach area, difficult areas, migratory population, urban slums, these are the vulnerable area where we need to strengthen our immunization program. And from coverage to life course protection, immunization is no longer only about infancy, it is about protection across adolescents, the adulthood, pregnancy, and healthy aging. And today, more than 30 life-threatening diseases are vaccine preventable. And I am happy to note that almost 7 new vaccines which have been introduced in last 5 to 7 years, namely the PCV, the pneumococcal conjugate vaccine, the measles rubella vaccine, the Rota vaccine, TD vaccine, IPV, and now the country is undergoing a HPV vaccination campaign for 14 years of girls. So what is required to bridge this immunity gap? Because we all have collected today in this evening at 5 p.m. to understand the importance of vaccination in the country, not in the infants or adolescent, but in the pregnant women or in the women at large itself. So first is to reach to the unreached people. That is important, like according to the life course approach. So we have recently introduced the UWIN. UWIN is a digital platform where the name-based tracking of individual pregnant women or newborn happens, and we can just track those people if they are defaulter of their due doses of vaccine. Second is strengthening the routine immunization. Now we have a catch-up rounds, we have a intensified mission Indradhanush program, we have a mop-up rounds, but the crux of the matter is that we need to strengthen our routine immunization, which is happening in a routine system only. That need to be institutionalized, that need to be strengthened. Third is a building a trust, where our Foxy colleagues, our gynecologists, our Indian Academy of Pediatrics colleagues, and our IMA people, they play a very important building a trust. Unless until doctor speaks, unless until the physician speaks, the people, they don't come forward. There may be kind of a vaccine avoidance behaviors. There may be kind of a vaccine avoidance nature of parents, mother, caregiver. Anybody can be there, and then the clear communication, respectful listening, and evidence-based counseling are key to sustain this high coverage of immunity and that bridging the immunity gap. Fourth is the quality and safety. In a vaccination, the quality and the safety, they are equal important. And we have a very robust AI system, which is a data IT-based driven system where the quality is the foundation of the trust. We need to take care of all these parts. Then finally, the life course approach. It's not only a particular age group, but immunization must extend beyond childhood to adolescent, pregnant women, adults, and elderly, and strengthening community protection across and all the generations. The UWIN, which is an important digital platform, which we encourage to the private sector also, and we will request to the Foxy also, whatever vaccine they are giving, that can be captured in the UWIN also. But I'm happy to tell that almost 16 crore beneficiaries, they are registered in the UWIN portal, and almost 72 crore doses, they are being registered in the UWIN portal, by which we know by name the which individual got which kind of a vaccine. That is the beauty of our digital platform. We in the country, we use a even the electronic vaccine intelligence network, where the temperature of each machine in the country, that it be ILR, deep freezer, or walk-in cooler, walk-in freezer, they are all mapped in the even software. And then there are a temperature range. What is the vaccine temperature of that particular machine, whether it's less than 2 degree or more than 8 degree, that can be monitored through the even. Then we have a VPD, surveillance management information. So a lot of IT intervention took place in India itself, and almost we are global leaders into the IT intervention for strengthening of routine immunization in the country. And to the success depend greatly on the private sector participation also for the immunization program in the country, where Foxy colleagues, they play a very important engaging role for the strengthening of routine immunization, because this is a day for the immunization. So I was just taking this opportunity to deal and to interact with all of you, just narrating the importance of immunization. And pregnancy is a powerful tool of opportunity, powerful window of opportunity. Maternal vaccination with TDAP in private or TD under UIP program, which protects both for the mother as well as for the most vulnerable, the newborn child, which come into the community as of now. And then influenza vaccine, which my colleagues, they are going to discuss, that also play a very important role in the immunization, though it's not a part of a UIP program, but influenza people, they suffer kind of a common cold every year, the elderly people. So it's important, importance need to be known to the public also. And other defining milestone is the national HPV vaccination campaign, which has been launched by the Honorable Prime Minister of the country on 28th of February from Ajmer, Rajasthan, with a single dose strategy for 14 years of girls. And we have a target to achieve 1.2 crore girls belonging to 14 years of age. That is an important milestone. And we need help of all the Foxy colleagues which are working in the field level to address the myth and to guide families towards informed choices, science-based decision, and truly securing tomorrow by protecting today from the cervical cancer, which my colleagues, Dr. Nija Bhatla and other colleagues, they will be discussing in the detail. But this is another milestone which we have, which was the most awaited antigen for our adolescent girls. And we also recognize the vaccine hesitancy, which is rarely ideological, basically. It is usually driven by fear, confusion, misinformation, kind of a hearsay from other colleagues about the A5. But evidence and consistently that dialogue with the families and with the respectful, confident counseling by a trusted obstetrician, I think they are able to handle this hesitancy or a kind of vaccine avoidance behavior. And my colleagues, Foxy colleagues, their recommendation carries more weight than any campaign message, basically by word of mouth. And the government of India looks to the Foxy as a very key partner to strengthen TD vaccine, to have a strengthening of HPV vaccine campaign, which is ongoing, to support human adoption for the IT platform for strengthening immunization program, and to counter the misinformation through evidence-based consensus guidance. So at last, I would close my remarks by saying that vaccine have protected humanity for more than 200 years. Today, with the science, system, and leadership in place, can we do even more? By immunizing women, adolescent girls, we protect lives now and secure a healthier tomorrow for mothers, newborn, and future generations. I stop here, and thank you very much. And I congratulate all my Foxy colleagues, all senior faculty member from the medical college, all colleagues which are connected from the different parts of the country. And I congratulate Dr. Sam Sundar also for organizing and inviting all. And I'm happy to say that Dr. Bhaskar has also connected from Kolkata, and all my vice president colleagues from the Foxy. Thank you very much, and my best wishes to all of you. Thank you.
Thank you so much, Dr. Pavan, for highlighting all the vaccines which are being given by the government. It's an excellent initiative, and I think all of you have worked so hard for get all this. When we were actually students, we only heard of some vaccines, but now we know there's so many vaccines, and all of us should promote our girls and the women who are coming, we are coming into contact to take up these vaccines, because they are going to save generations, not just against one disease, but it also saves against some crucial diseases like cancer. So thank you so much, Dr. Pavan, once again, and thank you so much for the efforts.
It would be worthwhile to mention, while Dr. Pavan looks after maternal health, his first love is immunization. That's
yes.
it.
So thank you so much, Dr. Pavan, and over to Revati. So who's taking over, Shatabdi?
Requesting Dr. Asha Jain, madam, to please start with Dr. Neerja, madam's interview, ma'am.
Thank you so much. So, welcome, Dr. Neerja, ma'am, to this forum. And you have been a guiding light for all of us about HPV infection, vaccination, testing for years together. So, I bring to you a set of questions that patients have in their minds, and which actually sort of don't allow us to get the optimum results of HPV vaccination. My topic today is HPV, and Dr. Neerja Bhatla ma'am is past vice president of Foxy and also past professor at AIMS Delhi. Welcome, Dr. Neerja. I start with my first question. If you had just one message for every parent who is watching this program about HPV, what would that message be? Dr. Neerja, you are muted, please.
Can you hear me now?
Yes.
Okay, perfect. Thank you.
आपने फिर खुद को म्यूट कर लिया, डॉक्टर नीरजा। आप फिर म्यूट हो गई हैं।
Is it okay? I don't know why it is going automatically into mute.
Okay. और
I don't think the microphone wants me to speak.
नहीं, हम बिल्कुल चाहते हैं कि आप बात करें, और चूंकि ये FB लाइव है, इसलिए मैं आपसे अपना प्रश्न हिंदी में दोहरा रही हूँ कि आपको यदि केवल एक सेंटेंस बोलना हो तो हर माता पिता के लिए आप क्या कहना चाहेंगी?
थैंक यू डॉक्टर आशा, आज के प्रोग्राम में इतने अच्छा सा प्रोग्राम में मुझे बुलाने के लिए आपकी बहुत शुक्रिया। और एट द सेम टाइम मैं उनका सबका थैंक्स करूंगी जिन्होंने इसको ऑर्गेनाइज किया है, डॉक्टर मोनिका, डॉक्टर Sarita, and of course our President, Dr. Bhaskar, our VPs for these committees, who are all taking active role in promoting the World Immunization Week. It's really nice to be here today. और इतना अच्छा keynote address अभी सबने सुना ही है. तो इस पे अगर आप मुझे पूछें कि क्या एक मैसेज है जो सब पेरेंट्स को दें, तो मैं कहूँगी कि एक बहुत हर्षोल्लास का समय है ये हमारे लिए, जब हमारे अपनी कंट्री में इतना सारा प्रोग्रेस है इम्यूनाइजेशन के फील्ड में, जिसके कारण हमारी बहुत सारी बीमारियों से बचाव होता है, और ये एक बहुत इम्पोर्टेंट रोल प्ले किया है, जो हमारी लाइफ एक्सपेक्टेंसी निरंतर बढ़ी है from being around 30 years at the time when we got independence to having crossed 70 years now. इसका बहुत सारा रोल है in being able to control infectious diseases. और जहाँ तक के एचपीवी वैक्सीन की बात आती है, तो मैं कहूँगी कि ये एक तरह से आप कहिए कि एक बहुत ही अच्छी बात है कि ये जो कैंसर है, इसका कारण एक वायरस है जिसके अगेंस्ट हम वैक्सीन बना चुके हैं, और इससे हम बच सकते हैं. सिर्फ एक इसके अलावा लिवर कैंसर है जिसके लिए वैक्सीन है, जो हेपेटाइटिस बी वाली जो बचाती है. तो मेरा एक और सिर्फ एक मैसेज ये है सब पेरेंट्स को कि ये एक बहुत ही अमूल्य दान कहिए, गिफ्ट कहिए, जो आप अपने बच्चे को दे सकते हैं. और इसके लिए अभी तो जो स्थिति है, जो सरकार ने इसको मुफ्त उपलब्ध करा दिया है, तो इसमें तो पेरेंट्स बिना कुछ खर्चा किए हुए भी ये एक बहुत बड़ी गिफ्ट दे सकते हैं कि आप इस इन्फेक्शन से बचाएं, आप बीमारी से बचाएं, और एक उनकी दीर्घायु की इस प्रकार से हम कामना करें.
धन्यवाद नीरजा मैम. एक दूसरा सवाल ये है कि हमारे पास वैक्सीन है, हमारे पास टेस्ट भी है, फिर भी हम इतने सारे कैंसर, सर्वाइकल कैंसर के केसेस क्यों देख रहे हैं?
नहीं, ये ना जो एक हमें ये समझना होगा, और ये बहुत दिन से हम जानते हैं ये सारी नेचुरल हिस्ट्री को, तो क्योंकि सर्विक्स को हम बहुत इजीली एग्जामिन करके और उसके सारे हम बायोप्सीज बहुत एफर्टलेसली लेके ये सारी नेचुरल हिस्ट्री हमें पता थी. सिर्फ ये एचपीवी वायरस वाली बात पिछले 30-40 वर्षों से सामने आई, और ये सब वैक्सीन और टेस्ट बने हैं. तो ये जो वायरस है, इसकी इन्फेक्शन होने के बाद काफी समय लगता है, कम से कम 10-15 साल का समय रहता है, जब ये नेचुरल हिस्ट्री में प्रोग्रेस करता है. इन्फेक्शन होती है, 90% लोगों में क्लियर हो जाती है, 10% में समझिए एवरेज नहीं होती अगर, तो उनमें रिस्क रहता है कि आगे ये बढ़ता जाए तो CIN बने, जो प्री कैंसर, और फिर फाइनली कैंसर. तो अब जो हम वैक्सीन आज की तारीख में लगा रहे हैं, कम से कम हमें 15-20 साल के बाद इसका असर इस गुट में पता चलेगा, और जो हम टेस्ट अब करेंगे उससे हम प्री कैंसर, कैंसर डिटेक्ट करके उनका टाइमली ट्रीटमेंट करके उनको भी हम बचा सकते हैं इस बीमारी से.
जी मैम, अब कुछ रैपिड फायर क्वेश्चंस हैं, क्योंकि पेरेंट्स के मन में बहुत तरह के सवाल होते हैं. तो वो जो सवाल अलग अलग पेरेंट्स से हमने सुने हैं, वो मैं आपसे पूछ रही हूँ, ताकि आपके मुंह से सुन के उनके तरह तरह के संशय मिट सके. तो पहली चीज जो पेरेंट्स कहते हैं कि मेरा बच्चा बहुत छोटा है, अभी से हम ऐसी वैक्सीन क्यों लगाएं जिसका सेक्सुअल एक्टिविटी से कनेक्शन है?
तो सबसे पहले तो मैं ये कहूंगी कि पेरेंट्स के मन में क्वेश्चंस होना, उनको का पूछना बिल्कुल जायज है, और ये दिखाता है कि उनको बहुत ट्रूली कंसर्न है बच्चे के लिए. तो हर पेरेंट नेचुरली ये नहीं चाहता कि मैं कुछ भी गलत करूं, तो पेरेंट्स में क्वेश्चंस होना भी नेचुरल है, और आंसर करना हमारा फर्ज है. तो जिसका भी जो सवाल हो वो जरूर पूछे, कोई भी सवाल छोटा नहीं होता है. तो दूसरी बात ये है कि किस एज में लगानी चाहिए, इस पे काफी स्टडी हो
I'll
चुकी
come
है.
to that, मैम. इतनी जल्दी
और
क्यों लगाना है?
हाँ, यही मैं कह रही हूँ. तो ये काफी स्टडी हो के ये तय हुआ है कि जितनी जल्दी ये लगता है, उसमें उसका रिस्पॉन्स सबसे बेस्ट आता है, क्योंकि कोई भी वैक्सीन क्यों ना हो, अर्ली एज में उसका बहुत इम्यून सिस्टम ब्रिस्क रिस्पॉन्स देता है। और दूसरी बात ये है कि हर हालत में ये तय करता है कि इससे पहले कि उनकी किसी प्रकार की सेक्सुअल एक्टिविटी एक्सपोजर हो, उससे पहले ही उनकी ये सिस्टम एकदम तैयार रहेगा इन्फेक्शन से लड़ने के लिए।
जी, एक और चीज है जो कई सोशल मीडिया पे एंटी वैक्सर्स डालते रहते हैं कि इससे इनफर्टिलिटी होती है, लड़कों में भी होती है, लड़कियों में भी होती है। तो इस पे आप क्या कहना चाहेंगी?
ये बहुत ही दुख की बात है, मैं तो नहीं समझ पाती हूँ। हम लोग क्लिनिशियन रिसर्चर्स अपने आप को मानेंगे, मोस्ट ऑफ अस हु आर डूइंग क्लिनिकल प्रैक्टिस और रिसर्च कर रहे हैं। हम लोगों का ना सीधा सीधा नजरिया होता है कि डेटा इकट्ठा करो, देखो ऑनेस्टली डेटा आपको क्या बोल रहा है। और अभी तक इतने सारे ये 500 मिलियन डोजेस लगभग हो चुकी हैं इस्तेमाल। 20 साल से ये वैक्सीन चल रही है।
एक
सारी उन लड़कियों में
500 मिलियन मीन्स 50 करोड़।
50 करोड़।
ओके।
50 करोड़, 4 करोड़ तो हिंदुस्तान में ही लग चुके हैं डोजेस। और हमारे अपने यहाँ पे जो हम स्टडी 2 डोज के करके लेके आए थे और 1 डोज की जो बनी, उन्हीं का फॉलोअप इतना स्ट्रिक्टली आज तक चल रहा है। कोई उसमें इनफर्टिलिटी नहीं, कोई अबॉर्शन नहीं, कोई प्रीटर्म नहीं, कोई स्टिल बर्थ नहीं, कोई मैलफॉर्मेशन नहीं। हम तो सिर्फ डेटा के बेस पे बोलते हैं कि कोई चिंता की बात नहीं है। एंटी वैक्सर क्यों बोलते हैं और किस हिसाब से बोलते हैं कि मैं ऑन रिकॉर्ड बोल रहा हूं कि आपको इनफर्टिलिटी होगी? कौन सा रिकॉर्ड, किस तरह से ये इंफॉर्मेशन आई? हम ना समझ पा सकते हैं कि इनके मकसद क्या हैं, क्यों ये लोगों को गुमराह करना चाहते हैं, और ना इनके पास कोई बुनियाद है। लेकिन ये टाइम टू टाइम नॉट ओनली एचपीवी वैक्सीन, पोलियो की वैक्सीन में भी एक बार मुझे याद है ये अफवाह उड़ी थी कि लड़कों में समस्या हो जाएगी और लोगों ने लगवानी बंद कर दी थी। तो मेरी तो एक ही रिक्वेस्ट है पेरेंट्स से, प्लीज बिलीव के डेटा जो आपको बता रहा है। प्लीज सी द वीडियोस जो लड़कियों ने दिए हैं जिनके खुद के बच्चे हो गए ठीक ठाक सबके। प्लीज अंडरस्टैंड कि आप जो अगर नहीं देंगे तो ज्यादा चांस है कि कोई इन्फेक्शन हो के उनकी फर्टिलिटी खराब हो, बनस्पत इसके के इन्फेक्शन के कारण, टीके के कारण आपको समस्या होने की चांसेस बिल्कुल भी नहीं है।
ऐसा भी कहा जा रहा है कि ये बड़ी नई वैक्सीन है, ऐसे ही लॉन्च हो गई है, कोई टेस्टिंग नहीं है। तो आप बता चुकी कि इसके लिए इतने लोगों का डाटा हमारे पास है ना? अब भारतीय, हमारी जनरेशन के लोग हैं जो कई जगह पे दे होल्ड पावर, परिवार में जो होता है वो लोग उनसे पूछ के किया जाता है। उनको आपकी क्या सलाह होगी? उनका कहना हमने तो नहीं ली वैक्सीन, हम तो बढ़िया हैं।
ये तो सही है हर एक वैक्सीन के लिए। हर एक को हम लगाते हैं, 2 मकसद होते हैं। एक होता है कि हम इंडिविजुअल को बचाएं, एक होता है कि एक हर्ड इम्यूनिटी जनरेट करके पूरी कम्युनिटी के अंदर से ही वो इन्फेक्शन की खत्म कर दी जाए। तो दोनों मकसद से ये देते हैं हम, चाहे कोई भी वैक्सीन हो। जरूरी नहीं था कि आपको होने वाला था, लेकिन आप फिर भी लेते हैं। तो ये वही सूरत है। एक्चुअली सर्विक्स कैंसर के बारे में मैं ये कहूंगी कि लोग बात नहीं करते हैं। ब्रेस्ट कैंसर के बारे में बात करते, संकोच नहीं करते। सर्विक्स कैंसर किसको हुआ किसको नहीं, बहुत ही कम लोग हैं जो हौसला रखते हैं सामने आके कहने का कि हाँ मुझे हुआ है। जाने क्यों है, ऐसा होना नहीं चाहिए स्टिग्मा, लेकिन थोड़ा है लोगों को संकोच। तो इसलिए हम कह नहीं सकते कि हमारे पड़ोसी को ये नहीं हुआ था या मेरी आंटी को नहीं हुआ था। अपना जरूर आपको पता है आपको हुआ या नहीं हुआ, बट ये नंबर 1 कैंसर था, अभी भी नंबर 2 कैंसर है, और इसकी पीड़ा बहुत बहुत ज्यादा है। तो इसलिए हमें बिल्कुल चांस नहीं लेना चाहिए। और पहले वैक्सीन थी ही नहीं, टेस्ट था ही नहीं, तो हम क्या कर सकते थे? लेकिन अब जब उपलब्ध है तब हम उसको मना थोड़ी करेंगे। जो जो हम तरक्की होती है, हमने पहले हमारे पास फोन नहीं थे, फिर फोन आए, वो बल्कि लैंडलाइन आई, फिर मोबाइल आए। तो हर टेक्नोलॉजी के साथ हमने बदला ना। हमने ये थोड़ी कहा कि पहले भी तो गुजारा हो रहा था इसके बिना, अब हम क्यों लें? तो वही चीज है एक्चुअली।
बहुत बहुत सही आपने जवाब दिया मैम। अब एक और चीज है कि इसका अर्लीस्ट किस उम्र पे लगा सकते हैं? और मान लीजिए जैसे अभी गवर्नमेंट ऑफ इंडिया 14 से 15 साल लगाएगी, डॉक्टर भास्कर पाल सर ने बोला कि हम 20 साल तक लगाएंगे, मगर अप टू विच एज हम ये वैक्सीन लगा सकते हैं? लेटेस्ट क्या एज है और यंगेस्ट क्या एज है?
तो वैसे तो जो लाइसेंस मोस्ट वैक्सीन्स का है ना, वो 10 से लेके 45 साल तक का है। किसी किसी में अभी 26 का है, आगे चल के वो भी बढ़ जाएगा। जैसे जैसे डेटा दिया जाता है लाइसेंस के लिए, वैसे वैसे लाइसेंस होता है। कहने की बात ये, अभी वैसे डेटा और भी आ रहा है कि इससे पहले भी लगाएं तो कैसे हो, क्योंकि थोड़ा बचपन में बच्चे आते रहते हैं वैक्सीनेशन के लिए, आसान होता है। एडोलेसेंट एज में नॉर्मल वैक्सीनेशंस खत्म हो जाती हैं, तो इसलिए इतना फ्रीक्वेंट वो आते नहीं है डॉक्टर पे, तो वो थोड़े से चैलेंज भी रहता है। सो आज की तारीख में 10 साल की उम्र से लेके 45 साल तक आप लगा सकते हैं। लेकिन देखा जाए तो जैसे जैसे उम्र बढ़ती है उससे बेनिफिट कम होता चला जाता है। तो इस कारण से सरकारें कहीं भी नेशनल प्रोग्राम्स में बड़ी उम्र में नहीं देती हैं। तो सरकार तो 15 साल तक ही देगी। आगे फायदा होगा, जरूर होगा। शादी से पहले जहां तक वो लगाएंगी 20 साल तक, बहुत ही काफी हद तक उनका भी इनफैक्ट बहुत हद तक होगा। और 30-35 साल की उम्र तक तो डेफिनेटली काफी फर्क होने की उम्मीद है। उसके बाद जो फायदा है, ऐसा नहीं है कि नहीं है, लेकिन घटता चला जाता है। स्क्रीनिंग की इम्पोर्टेंस बढ़ती चली जाती है। टेस्ट कराना बहुत जरूरी है। वैक्सीन काफी नहीं है किसी भी एज ग्रुप के लिए। तो इसलिए यदि उसको हम लगाएं तो नुकसान नहीं है, सिवाय इसके कि उस पे खर्चा करेंगे। तो बेशक लगाना चाहें उसके बाद भी लगा सकते हैं, लेकिन 45 साल के बाद जब पूरा सिस्टम हॉर्मोन्स वाइज क्लोज डाउन होना शुरू होता है, उसके बाद रिस्क कम होने के कारण उसके बाद लगाने से ज्यादा लाभ है।
अब एक बहुत पर्सनल सा क्वेश्चन है, और ये वो क्वेश्चन है जो हर पेशेंट या पब्लिक जानना चाहती है। आप एक महिला भी हैं, डॉक्टर भी हैं, आपने अपने परिवार में ये वैक्सीन यूज की?
जी हाँ, मैं तो हर एक को रिकमेंड की है, टाइमली लगवाई है। और जो लड़के हैं उनको भी एडवाइस किया है कि वो जरूर लगाएं। उससे ना केवल सर्विक्स कैंसर के से बचाव में, जैसे मैंने कहा, हर्ड इम्यूनिटी में बेनिफिट आता है, लेकिन उनको पर्सनली भी बेनिफिट है, क्योंकि कई कैंसर्स मेल्स के भी हैं जो इसके कारण है। उन कैंसर्स के बारे में हम कम बात करते हैं क्योंकि वो इतने कॉमन नहीं है, और उनका जो कंट्रीब्यूशन वैक्सीन वायरस के कारण है वो कम है। तो इसलिए हम उसके बारे में ज्यादा बोलते नहीं है, लेकिन लड़कों को भी अवश्य लगवानी चाहिए यदि वो लगवा सकें। और यदि कहीं भी कोई मौका ऐसा मिलता हो कि कोई ऑफर कर रहा है कि आज कैंप लगा रहे हैं, लड़कों को भी लगाएंगे, तो जरूर इसका फायदा उठाएं और लगवाएं।
आज हमारी बातें सुन के मान लीजिए कोई अभी तैयार होता है कि हम अभी जाके वैक्सीन लगाएंगे, तो उन्हें सबसे पहले क्या करना होगा?
जो आप 14 साल की लड़कियों की बात कर रही हैं, उनके लिए बहुत आसान है। यूविन का प्लेटफॉर्म है जो हर वैक्सीन के लिए है। उस पे रजिस्टर करेंगे, जैसे ही वो अपना एड्रेस डालेंगे, पिन कोड डालेंगे, तो वो खुद बताएगा कि आपके पास सबसे करीबी कौन सा है सेंटर जहाँ पे ये वैक्सीन उपलब्ध है और लग सकती है। और अभी 31 मई तक तो डेली लग रही है, तो इसलिए जाके वो वहां पे लगवा सकते हैं। लेकिन उनको अपने साथ एक पेरेंट को लेके जाना है जो साइन कर सके कंसेंट फॉर्म पे, और अपने एज का प्रूफ, आधार वगैरह लेके जाना है।
और जो 15 साल क्रॉस कर गए हैं उनके लिए?
तो जो 15 साल क्रॉस कर गए हैं उनके लिए भी एक ही डोज का रिकमेंडेशन है। और मैं ये कहूंगी कि आप उसको एक इंश्योरेंस मान के एक डोज के पैसे जुटा के लगवा लें तो अच्छा रहेगा।
आपसे आखिरी सवाल जो मैं करना चाहती हूँ वो ये है कि जो आपको सबसे डिफिकल्ट लगा हो एचपीवी वैक्सीनेशन में, कोई स्टोरी, कोई पेशेंट जिसको आपको कन्विंस करना दिक्कत हो, जिसके सवाल बहुत हो, उसको आपने कैसे मैनेज किया, ये आप बताइए।
मेन तो ये है कि जो लोगों को अभी तक तो वैक्सीन फ्री उपलब्ध नहीं थी, तो मेन चीज जो थी वो लोगों को हिचकिचाहट थी कि इसका खर्चा हमने करना है, क्या हम करें या नहीं करें। और उसके लिए हम उनको इसी तरह से समझाते हैं कि देखिए, यदि आप इसको लगवा लेते हैं एक बार, उसके बाद नॉट कि इम्पॉसिबल है, फिर भी स्क्रीनिंग करनी है, फिर भी एक थोड़ा बहुत रिस्क तो रहता है कि किसी दूसरी टाइप के इन्फेक्शन हो जाए या कुछ हो, बट बहुत सिग्निफिकेंटली आपका 80-90% रिस्क कम हो जाता है। और यदि आप नहीं लगवाते हैं, और बाद में हम कितनी लड़कियों को देखते हैं आजकल जो इनफर्टिलिटी की क्लिनिक में गए, वहां से टेस्ट कराया, तब CIN निकल आया, सब सारा आपका बदल गया रुख, आप चले थे बच्चा करने के लिए, पता चला आप CIN के ट्रीटमेंट में उलझ गए, सारा उसका टेंशन, अब ये इन्फेक्शन हो गया, इससे मेरे को कैंसर होगा या नहीं होगा, इन सब चीज़ों से आप बचेंगे। और जब लोगों को समझ आती है कि इसका कितना बेनिफिट है, एक सिंपल इंजेक्शन लगा के इतनी बड़ी बीमारी से बचा जा सकता है, तो जनरली स्पीकिंग मैंने देखा है कि कोई समस्या नहीं होती है। इवन फर्टिलिटी वगैरह की, क्योंकि हमारे पास अपनी लड़कियों के सबूत हैं कि उनको कोई प्रॉब्लम नहीं होती है, वो लड़कियां खुद एम्बेसडर बन के लोगों को बताती हैं कि आप लगवाइए, इससे लाभ है, इसमें कोई नुकसान नहीं है, कोई सीरियस साइड इफेक्ट ही नहीं है।
बहुत बहुत धन्यवाद इस कार्यक्रम पे आने के लिए, और हम सबको एक बार अपनी जिम्मेदारी और HPV सेफ्टी के बारे में बताने के लिए बहुत बहुत धन्यवाद। धन्यवाद डॉक्टर मोनिका और पूरी टीम आज के इस कार्यक्रम में हमें मौका देने के लिए। नमस्कार।
बहुत शुक्रिया डॉक्टर आशा, थैंक यू वेरी मच।
Thank you, Neeta ma'am, for joining us. It is an honor to have you with us today.
Thank you, Dr. Monica.
I can see Dr. Abharani Sinha madam who has also joined. So, ma'am, can we have some comments from your side as the Vice President of Foxy?
Thank you, Monica, for inviting me to speak on this wonderful Immunization Week celebration day. And it was really so nice to hear Dr. Neerja Bhatla, ma'am, who has been the pioneer in introducing HPV vaccine in the government sector. So, and of course, Dr. Pawan Kumar sir is there, and who is also doing so much of work for immunization. I think we all need to work together to make this program a great success. And we want all our girls to be immunized with HPV vaccine. Thank you so much, Monica, for inviting me to speak.
थैंक यू डॉक्टर आभा जी, आपने तो बिहार में लॉन्च वाले दिन आप ही थी जो बिहार की लड़कियों को आपने वैक्सीनेशन पिछले साल शुरू कराया, और आपका एक्सपीरियंस, अनुभव आपका बहुत सबसे ज्यादा है इस विषय में, तो रियली वी आर सो प्राउड ऑफ यू एंड ऑल योर वर्क दैट यू आर डूइंग। थैंक यू।
थैंक यू निर्जा जी, आपने बड़ाई की, लेकिन आपने इसको नेशनल लेवल पर लाया। हमने बिहार सरकार को इसको लाने के लिए बिल्कुल हम लोगों ने बिहार सरकार में बहुत ज्यादा कार्य किया और उन्हें इसके बारे में एडुकेट किया, लेकिन आपका ये कंट्रीब्यूशन पूरे भारतवर्ष के लिए है। बहुत बहुत धन्यवाद।
थैंक यू।
Thank you, ma'am. Now let us move forward for the next segment. Yet an simple but life-saving intervention in pregnancy, that is the Tdap vaccine. And it is an honor to have Dr. Anaita Chavan with us, an eminent expert in maternal and child health and the Joint Associate Editor of Jogi. मैम, सबसे पहला सवाल आपसे ये रहेगा कि ये Tdap वैक्सीन किन बीमारियों के लिए लगती है, and why are we actually talking, and what is the importance in taking it in pregnancy?
Thank you, Monica. I hope my screen is visible and I'm audible.
Yes, ma'am.
Yeah. So just to give you some background, since the 60s, all we were talking about was tika, tika lagao. And every mother, every expectant mother knew that she had to take 3 doses of TT initially, which then was modified to 2 doses of TT. Now TT has become obsolete, and we recommend, instead of 1 dose of TT, we recommend 1 dose or the first dose as TD. And the government sector has been excellent in promoting this. And the second dose of TD should be replaced with Tdap. Now, talking about Tdap, Tdap is tetanus, diphtheria, and acellular pertussis. Now, tetanus, if we know, has literally almost been wiped out. So we don't see cases of maternal or neonatal tetanus the way we saw 50 years ago. Diphtheria is important because it goes hand in hand with the tetanus vaccine, and
it is more effective to give tetanus with diphtheria. The most important addition is acellular pertussis, because pertussis, though is not infective to the mothers, it's a very, very important vaccine preventable illness in the newborns and the infants. So the Tdap vaccine is recommended to be given to all pregnant women in the 3rd trimester of pregnancy, so that they can be protective to the infant in the first 1 to 2 months of age. So in the first 1 to 2 months, there is an immunity gap because the infant's DTP or DPT vaccine begins at 6 weeks of age. If you are aware of the universal immunization program, which is all over the country and which is going fantastically well, the first dose of DPT is given at 6 weeks, 10 weeks, 14 weeks. So there are 3 primary doses of DPT. Now, obviously, in the gap between the time the first dose is taken, in case the child is exposed to pertussis, the pertussis can become more severe, and the highest morbidity and mortality in infants and newborns is seen in the first 2 months. So the vaccine is given to the mother in the 3rd trimester so as to protect the infant before the infant's vaccination takes over. I hope that is clear.
Thank you for explaining how maternal vaccination definitely protects the newborn in the first few months of life. But there is still a lot of hesitation in patients regarding any vaccine that we recommend during pregnancy. So how do we say that? How safe is Tdap? So what are the current evidence on that?
So Tdap is a toxoid vaccine like TT and TD. So like these vaccines, it is a toxoid vaccine. It is not a live vaccine. It is a basically killed vaccine. So it is perfectly safe to be given. That's number one. Number two, whenever we explain to mothers that this vaccine is going to protect your child, there is no hesitancy to take the vaccine. I know I'm going to preempt what Dr. Krishnendu will talk about influenza, but when we talk about influenza, it is protect you and your child. But in Tdap, it is all about protecting the newborn. And I think there is no mother who will refuse to give the Tdap vaccine. Yes, there may be some who may have financial difficulty because this vaccine has not yet come into the schedule of vaccination for pregnant women. That's the only constraint. But again, taking from what Dr. Nirja said, it's an investment in your child. And the childhood vaccinations are fairly expensive. It's always better to give the maternal vaccine, which is hardly 15 or 1600 rupees, and protect the mother as well as the infant.
For years long, everybody has only spoken about tetanus toxide. That is what you spoke in your first answer. And many of us are only accustomed to giving TT. So why is Tdap more preferable if I have to explain this to my patient in just 3 or 4 lines in a busy OPD? What would be the key message that you would convey?
So basically, TT is like water. And even the government has stopped using TT. So it's high time the private practitioners replaced TT with TD. That's my message number one. Stop using TT. Replace all TT with TD. Give the first TD as soon as the pregnancy is confirmed or whenever the patient comes first in pregnancy. This is important. And here again, I would say the public sector is doing a much better job than the private sector because they do not let a single patient go. So even if the patient comes in the first trimester or the second trimester or even the third trimester, the first TD is given. The Tdap should be given ideally between 27 and 36 weeks of gestation. And so the second dose of TD should be replaced with Tdap. What I would explain to parents is this is something that the mother will do for her child as a passive immunity. And if the child gets infected, it will be very, very difficult to manage. So Tdap will bridge the gap. It will bridge this immunity gap, and that's why it should be given in the third trimester. Suppose we have mothers who miss out on taking it in the third trimester. We can even give it immediately postpartum because that will also protect the infant.
Ma'am, there is a myth saying that if the patient has already received a Tdap earlier, she does not need it to be taken in pregnancy, or for that matter, even in the second pregnancy.
So the thing is that this vaccination is for each and every pregnancy. Even if her pregnancy has been just 1 year apart, suppose she delivered last year and now she's pregnant again, she needs to take Tdap for this child to be protected. So we have to explain that for each and every pregnancy, she needs a Tdap. If she's pregnant 5 times, she needs a vaccine each time she's pregnant so that that child is protected.
Right. So there are also some questions whether it could cause any congenital issues or whether it
No.
could
So
cause any
actually,
second preterm
let
in
me tell
the.
you that I first started talking about Tdap vaccination when the pediatric group invited me to speak. It was not even in the domain of OBGYs, and the pediatricians asked me to speak on Tdap. This was, of course, probably 15 years ago, and I did my research at that time, and it's recommended first by the pediatricians, and then OBGYs jumped onto the bandwagon and started recommending Tdap. So there are enough studies to show that there is no effect on the fetus or the newborn, no congenital problems, no birth defects, nothing. It's literally the same as tetanus toxoid.
So whether any pregnancy.
Also, the pertussis component is acellular pertussis. So that is extremely safe, and it is a smaller dose than what would be given to the newborn.
So whether low risk mother or a high risk pregnancy, it should be universal.
It does not matter.
Yes.
It does not matter. The other thing I would like to say is that in the West, they are giving Tdap even at earlier gestations. But for us, the maximum time that the protection passes on to the infant is in the third trimester. The maximum antibodies by the mother are prepared in the third trimester. And so it's better to give it after 27 weeks. However, suppose the patient has a bad wound or an outbreak of that infection and she needs a tetanus. Rather than giving tetanus, you can give Tdap even earlier in the pregnancy, and that will be fine.
We've already spoken about the recommended schedule that as soon as the patient comes, we would give the first dose of DT and then we would follow it up.
TD
and DT
not
will be.
Not TT. I want to ban
DT, ma'am. Diphtheria and tetanus toxoid, which the
Yes.
government vials are coming. They're labeled
Right.
as DT vaccine. So one as soon as the patient comes, and the second one would be approximately after.
I'm sorry. The government vaccine is labeled as big T, capital T, small d.
D.
It is
Yes, ma'am.
not DT. It is big T, small d, and that's the correct adult dose.
So, and the second one would be at 27 weeks onwards. Ma'am, what were the common counseling challenges that you faced in the last few years, making people understand why Tdap vaccination is
So I
important?
think the first and the most important is that the obstetricians need to understand that this is a non-negotiable vaccine. Some obstetricians still feel कि TDAP नहीं लिया तो भी चलेगा, TD ले लो. But obstetricians, if they promote the vaccine, then it's been shown that 5 times the number of patients will accept the vaccine. So we have to start promoting the vaccine. In a busy OPD, it may be very difficult, but still you can say 3 words. This vaccine is necessary. This vaccine will protect you, but more importantly, this vaccine will protect your unborn child before the child's vaccination begins. And I think that's all that we need to tell mothers, and they'll be able to then, give it to the children.
Well, is there anything that we can make to improve the compliance so that no mother misses this dose? Whether it is public partnership, private partnership, or talking to the company.
Unfortunately, TDAP is a bit lower on the hierarchy of public domain vaccines as of now. And I do feel that influenza is going to be slightly higher on that list as compared to TDAP. Because in terms of absolute numbers, the people getting influenza and succumbing to influenza related deaths is much higher than the pertussis related deaths. But what we can do is start promoting Tdap vaccine. Once the vaccine comes into our armamentarium as private practitioners, the cost will also drop. And once the cost drops, it is easier to then convince more and more patients to take the vaccine. In fact, I would like to tell you that some of my patients where financial issues are not a problem are vaccinating their partners as well as the grandparents as well as their household help with Tdap. And the recommendation is that all household contacts of the infant should be vaccinated 15 days prior to contact with the infant. And I have had at least 3 or 4 couples who have come with their house help also and given her the Tdap vaccine. So it's difficult initially, and I've been talking about Tdap now for 10 years or more. It will come into our armamentarium sooner or later.
Sure, ma'am. Let's move on to a quick rapid fire round, ma'am. Can this be administered with other vaccines in pregnancy?
For sure. And that's something that COVID taught us when we had very limited interactions with patients. CDC and all other agencies recommended co-administration of vaccines. So you can give influenza vaccine as well as Tdap vaccine at the same time at 28 weeks on 2 different sites. And in the co-administration will improve the sort of catchment of patients, because then you don't have to convince them about vaccination at each visit. You can say in one go, you need these vaccines and I'm giving them both to you. The other important point is that if you don't keep the vaccines, if you don't stock the vaccines and you talk about the vaccine, it doesn't work, because the next time the patient comes, the patient has forgotten about it. Have the vaccines on hand in your refrigerator through the proper cold chain and tell the patient, I'm giving it to you right now.
Yes, ma'am. What are the strategies that we can adopt at a national level to improve this maternal immunization coverage?
So the maternal immunization coverage at the national level is still talking about 2 doses of TD. And we need to bring in the TDAP by showing data. And here we'll need to take the help of the neonatologists and the pediatricians, because unfortunately, though pertussis is supposed to be a reportable illness because it's a vaccine preventable illness, the number of cases which are getting reported is very low. In fact, data shows that for every one case which is reported, there are more than 80 cases which exist, which are not reported. So our aim should be to tell our pediatricians, confirm pertussis, because it requires a swab rather than just the whoop of the cough. Because as you know, pertussis is whooping cough. So typically many of the pediatricians will hear a whoop and assume it is pertussis. So confirm pertussis with a swab and report all cases. Once we can show the government that there are serious numbers and babies who are having morbidity as well as mortality because of pertussis, only then the Tdap vaccine will come into the common OBGY practice.
And one key message to the expecting mothers and one key message to the OBGYNs.
So first I'll say for the OBGYs, unless you have the vaccine and unless you are comfortable administering the vaccine, your patients are not going to take the vaccine. So start giving the vaccine. It's a perfectly safe vaccine. There is no side effect. And you explain to the patients that, like all vaccines, you may have some local pain and you may have some malaise for 24 hours. It's a very easy vaccine to give. Unlike influenza or HPV, where there's far more hype about the vaccine, with Tdap, there's literally nothing to bother about. One message for the patients: you are protecting your unborn child. And that's the only message that actually works for mothers. I mean, if any mother is told, if you give this vaccine, you're protecting your unborn child from severe disease, no mother is going to refuse the vaccine.
Yes. Thank you, ma'am, for simplifying this very crucial topic, that protecting the newborn starts before the birth, and Tdap is a very important and vital step in that journey. So let's all commit to a safe motherhood and healthier babies. Thank you for being with us today.
Pleasure.
Yeah.
Pleasure.
I would now request Dr. Kanchan Sharma, madam, to please carry forward the next session.
Thank you, Monica. As I am hearing since very beginning, very vital discussion is going on. नमस्कार. शुरू में 2 लाइनों से, टीकाकरण सिर्फ एक सुई नहीं है। टीकाकरण सिर्फ एक सुई नहीं है, सुरक्षित जीवन का संकल्प है। आइए ज्ञान बांटें, जागरूकता फैलाएं और हर घर को रोगों से बचाएं। माई सेल्फ डॉक्टर कंचन शर्मा, chairperson of NCD committee FOXY, welcome you all in this very important Facebook live session of Immunization Week, which is being guided and nurtured by our FOXY president, Dr. Bhaskar Pal sir. So myself, with the chairperson of 4 other FOXY committees, is there on the occasion of Immunization Week. We had a beautiful quiz session from 23rd to 29th April. My heartful thanks to all of you. Today, we are lucky enough to have stalwart in the field of vaccination, Professor Krishnendu Gupta sir. He is unit head in the Department of Obstetrics and Gynae, Vivekanand Institute of Medical Sciences, Kolkata. He is stalwart in women's health and he brings decades of clinical excellence, academic leadership, and a global influence. Sir has held several prestigious national and international positions, including AOFOG, FIGO, and FOXY. He is a respected teacher, leader, and the mentor, and continues to inspire the next generation. Sir, we welcome you here to this podcast. Sir,
thank you very much,
because we are
Kanchan,
dealing
and
with, thank you, sir, influenza. So my first question, without wasting time, I'm just asking to you that why influenza matters in pregnancy, or why is influenza considered more dangerous in pregnant women, sir?
well, I will straight away, before answering your question, I'll thank Dr. Bhaskar Pal as well as the entire office bearers of FOGSI for giving me this opportunity. But I'll take off from where my dear friend Dr. Anahati Chauhan, after her very nice and very lucid presentation on the Tdap vaccine, left. There's a saying by Confucius way back, Chinese philosopher: one who does not think and plan ahead will find trouble right at her door. And this is exactly about with the influenza vaccine. This influenza is more likely to cause illness in a pregnant woman than in a non-pregnant woman. And women in the second and third trimesters of pregnancy are at increased risk of severe illness for hospitalization, and death. So it's severe illness. It's very, very important that we treat this. And there is incidence of increased hospitalization, increased ICU admission. There's a higher mortality than non-pregnant women, as I've said. And there's the various complications of influenza, which can be a severe pneumonia because there's a reduced lung capacity due to the gravid uterus, and because of this, all these problems. And then, of course, it translates also to the baby. And again, Dr. Anayata very beautifully mentioned that if we can inform the mother that this vaccine is also going to help the baby, they are going to be very happy, because it is very clear that it also affects the baby.
Sir, thank you. You mean to say because of the altered immunity in the pregnancy
Absolutely.
and low lung capacity, this normal influenza can change into the difficult version. That means
yes, there is a relative immunosuppression. So I don't want to, because this is a Facebook Live, I don't want to get into TH1 and TH2 and stuff like that, but there is definitely a problem. There is a relative immunosuppression because of which we have all these problems.
And moreover, this influenza can, when this becomes severe, this can cause preterm labor or the fetal.
Of course.
That will lead to low birth. Yes.
Low birth weight and things like that.
Thank you, sir. Does this influenza infection affect the fetus directly also? If the mother is affected with the influenza infection, can
yes,
this
both directly and indirectly. I'm sorry, both directly and indirectly, because there's a high maternal fever, and because of which it can also give rise to problems like placental insufficiency, which can give rise to, and it's been shown that that there are incidences of neural tube defects and congenital anomalies and things like that, including fetal growth restriction, preterm birth, and of course preterm labor.
So we have to spread this message very
Yes.
vastly कि वही lady अगर same flu pregnancy में उसको होता है, तो that will affect fetus as well as mother also. So we need to have flu vaccine, that is the influenza vaccine. So coming
Correct.
to my next question, that whether this influenza vaccine is which type of the vaccine which we are giving, which we
No, we are giving a it's not a live vaccine. We are giving the quadrivalent one. There's a trivalent as well as quadrivalent. We always prefer to give the quadrivalent vaccine. And that's the one which is recommended. And it is very important that we must clarify, as you very beautifully mentioned in Hindi, that it is not a live vaccine.
It is inactivated.
So it is safe in all trimesters. It's an inactivated vaccine. So it is safe in all trimesters. And it's a must-give vaccine. It's given by intramuscular injection. And we normally, of course, there is a live, people must know that there is also a live vaccine, which is given as a nasal spray. We do not, I repeat, we do not give it in pregnancy. We only give the intramuscular injection of the quadrivalent vaccine.
So now the concept of giving this influenza vaccine has come in the pregnancy, as contrary to before, as Anita ma'am has also discussed that initially we were only promoting TT vaccine in pregnancy. Now Tdap as well as the influenza, because of the more understanding of the immunization, we just prefer these type of the vaccination. So what is the best time to give the influenza vaccine? As the patients are coming to all of us, and we should know which is the best time to give this vaccination.
You see, there is no good time or bad time. It can be given at any stage of gestation. First trimester, second trimester, third trimester. You can, the moment a patient comes to you, you must counsel her. They are all, most of the patients, some of them have this thing ki hum first trimester mein to ye hoga, wo hoga and all that. But you have to tell them, no, it's safe. It's absolutely proven beyond doubt. So therefore, you have to give them. Because, in India, we have a kind of twice a year, there's a flu season. It's not only once. So there is nothing called as good time or bad time. Whenever she comes, you should actually give it to her. So that's very important.
Yes, sir. Very good. Because before the epidemics start, that is before the monsoon season or before the winter, when this flu season start, we should give this vaccine to our pregnant ladies.
Yeah.
Better if we give in the third trimester. What is the extra benefit? Does this immunity passes to infant also?
Yeah. Very beautifully said, because that has also been highlighted by Dr. Anahita. So, that there is a passive immunity which protects the child. So that's very, very important. And that is your USP to tell the mother that, yes, when we give you the vaccine, it's also for the baby. So it's very important, not only for her, because as I said, a pregnant woman is got a lot of problems with infection with the influenza virus. Unlike TD, which is only for the baby. Here it is both for the mother as well as the baby. So it protects.
Oh, thank you. So we have to spread this information that
yes,
this influenza vaccine protect your baby also even after the delivery, because they are being transferred transplacentally by the IgG antibodies, which protect your baby even after delivery up to 6 months, when we cannot vaccinate newborn by this influenza vaccine. Thank you,
absolutely.
sir. What are the safety concern and the myths? Many patients, they fear in the pregnancy. How safe is it really? Please explain.
You see, Pavanji mentioned very clearly there's something called as vaccine hesitancy, which is a huge, huge problem in our country. You'll find people saying more negative things about a vaccine than the positive things. And it gets circulated. And that's the worst thing, even about the HPV vaccine. There are still people talking some nonsense about it. And this is the same thing. So we have to be very clear that we make the people aware that there's an extremely safe vaccine. There is no increased risk of things like miscarriage or congenital abnormalities, preterm birth, and things like that. So there's absolutely there's absolute clarity of thought that we must promote this vaccine, and it's a must-give vaccine.
Thank you, sir. This is very important statement by you, that it should be very clear to each of us, to the patient also, that it doesn't cause any harm to mother as well as the baby.
Yes, and not only that, the WHO, World Health Organization, the Center for Disease Control, CDC, as well as our own beloved federation, FOGSI, strongly recommends it. And if you as a doctor recommend it to your patients, most often they take it.
And this is a most common myth, that this vaccine itself cause influenza vaccine. So you have to remove this myth from the patient's mind.
Absolutely.
Because some patients, as after giving the vaccine, can have a mild symptom of low-grade fever, body ache, and even minor immune responses. But that is different from the flu itself.
Correct.
Sir, thank you. Just I want to know your opinion about, are there any side effects, as the people may ask to us, of this particular vaccination?
Yeah, there is definitely, at the injection site, there could be, pain. You may have a little bit of fever, and some people may talk about some amount of fatigue, etc. But the serious, adverse effects are extremely rare, unless there is someone is actually predisposed to anaphylaxis or something like that. Otherwise, it is a very safe vaccine.
So this is very important to spread the awareness that this is a very safe vaccine. Few mild side effects may be there and they suppress with the time. So should all the pregnant women be vaccinated or only high risk ones, as the patient may ask to us? Just for our knowledge.
Absolutely all women.
All
women should be vaccinated. Because of course, there are people who have got other medical disorders who are even more, susceptible to problems. So it is very important that we counsel each and every pregnant woman to take the influenza vaccine.
So, sir, thank you. As you have strongly recommended about the universal vaccination,
Yes.
although the immunity may be more needed in some high-risk diabetes, asthma, heart disease, obesity patient, but we recommend to each and every patient, pregnant lady, to take this vaccination. So, can
Yeah,
it be
because
given along
it's
with
very
other vaccines?
clear. Kanchan, it's very important for us to tell them very clearly that the benefits that it gives not only to the mother but also to the baby. It reduces doctor visits. It kind of, it's so important, because if someone falls sick, you're going to go and visit the doctor. It reduces the incidence of, influenza during pregnancy. It gives passive protection to the baby. It decreases adverse fetal outcomes, financial benefits. The moment you talk about finance, it kind of hits them. And you've already spoken very beautifully about the transplacental antibody transfer and the reduction in perinatal incidence, etc. So both the benefits to the mother and the baby have to be highlighted, when we speak about the vaccine.
And as already highlighted by Dr. Anahita, madam, that it can be given along with the TDAP, because these are the most common questions by the patients.
But make sure that you give it in 2 different injection sites. That's important.
So what if a pregnant woman already has a flu symptom? They are just asking, if already, madam, I am having the flu symptom, should I get it or should I wait for the flu to subside? What is your opinion?
See, in our clinical practice, most often they don't like to take the vaccine at that point of time. So it's better that, as long as, the follow-up is very important, you tell them the moment you feel better, please come and get the vaccine. So it's very important that you don't lose the patient.
Right.
And of course, if she's already suffering from influenza, then of course, then we have to think if it's, to make sure that she doesn't have all these other problems of, what we mentioned, the problems in pregnancy about, getting into, very sick and pneumonia and ICU admission. We have to start some kind of antiviral, therapy like oseltamivir, etc. Of course, but it has to be proved.
It is preventive, not the therapeutic.
Exactly, it is preventive and not therapeutic. A very well spoken. Yeah.
So in Indian scenario, what are the challenges in India regarding the flu vaccination in pregnancy? Already we have discussed a lot. Sir,
As I said,
again,
it's
I
vaccine
repeat.
hesitancy because of lack of awareness. Our own healthcare workers are not sure. Our own, it's very important that even if you're in a clinic or in a hospital, when a patient comes and speaks, the person, they normally, whenever you, like even with an HPV or a Tdap or whatever, they may ask the person who's in your clinic or in the hospital that, ye kya bol raha hai, ye safe hai ya nahi. Even the people around you must speak positive about what you're speaking. So it's very important that about the seasonal variability, etc. is important, but you have to be very pro the vaccine, and the recommendation must come from you. And once the recommendation comes from you, whether the patients do their Google search, Dr. Google helps them or whatever, they are going to be, make sure that, and you tell them that whatever are your clarities about your myths and misconceptions about the vaccine, you are there to take care of them and answer them effectively and to the best of your ability.
Right. So all the doctors and the paramedics also, along with the patient, should know all of this very clearly. So how
Absolutely.
should we counsel the hesitant patient? I want to know the 3 simple points from you, sir.
Well, the first thing will be to highlight how dangerous a flu or influenza can be during pregnancy. I cannot say that enough. It has to be highlighted to them. The problems that can not only happen to the mother, but also to the unborn child. So by giving the vaccine, you're protecting not only the mother, but also the unborn child and the newborn thereafter. So advocacy is most important. And for that, we need awareness. And you must reassure in the simple language that you can give regarding the vaccine and share them, share your knowledge in whatever way possible.
Thank you very much. Sir, really, you highlighted very important point regarding the influenza and special obligation to you. We all are obliged by this very important information, and you are going to US also for ACOG day after, I think tomorrow you are going, and even then you spare time for us. We
Thank you.
all
It's a
are
pleasure.
highly obliged and thankful to you.
Thank you so much. Thank you. Thank you. And thank Foxy. Thank you, Dr. Monica, as well.
Yeah. Thank you, sir.
And everyone else, the Vice President, Dr. Abha, and everyone. Thank you.
Thank you, sir, for sparing your valuable time and giving a lot of input regarding the influenza
But I'll just
vaccine.
end with one comment.
Yes,
Getting the flu
yes, sir.
vaccine is safer than getting the flu.
Definitely, sir.
Yes, thank you so much. Thank you,
Sir.
sir. Thank you,
So,
Monica, and all.
so let's come to the fag end of the program. I would invite Dr. Archana Kumari, madam, to please give the vote of thanks.
Yeah, thank you, Monica. It is indeed an honor to propose vote of thanks for today's enlightening Facebook Live session on Immunization Week and with the theme of Protect Today, Secure Tomorrow. At the outset, I would like to express my heartfelt gratitude to Dr. Bhaskar Pal, Foxy President, and Dr. Suvarna Khadilkar, Madam General, for their constant guidance and support and providing this platform to spread awareness on this crucial public health issue. And I would also like to express my gratitude to all the vice presidents, Dr. Vidya Thupi ma'am, Dr. Abharani Sinha, Dr. Meenu Agrawal ma'am, and of course, Dr. Preeti Kumar madam, who's joined through Facebook live session. And we missed Anju Soni madam today. And also thanks to Dr. Soma for this enlightening session. Hello, am I audible?
Yes, yes. Audible and visible.
Actually, I thought there was silence over there.
No, there's wonderful. We are all listening to you in rapt attention because we have to thank President, Vice Presidents, all of them. They're wonderful.
Yeah. And so I also want to acknowledge Dr. Soma Datta, the Joint Secretary,
Yes.
always working hard behind the scene. And of course, I'm grateful to distinguished keynote speaker for today, Dr. Pawan Kumar, for expressing
Absolutely.
his wonderful views on immunization. And we all know he worked so hard for maternal health and especially for immunization. And I would also like to acknowledge Dr. Sarita Samsundar for graceful introduction of our key speaker and for ensuring that session flowed seamlessly. And of course, I'm grateful to insightful discussion and engaging discussion by our expert today, Dr. Nirja Bhatla madam, for her views on HPV vaccine, Dr. Natya Chauhan madam for her views on Tdap, and of course, Krishnenu Gupta sir, yours view on influenza. That was absolutely wonderful. I hope whoever have joined through Facebook Live, they go with clear-cut key messages, and your insights are helpful to overcome the vaccine hesitancy. And of course, I would like to express my thanks to wonderful interviewers for today, Dr. Asha Jain madam, Dr. Monica, and Dr. Kanchan Sharma ma'am. I would also like to acknowledge the presence of Dr. Rohan Palshikar, Dr. Satabdi Day and Dr. Revati Rane for warm welcome and inaugural session. And my sincere thanks to the entire organizing team for their excellent planning and execution, especially to Monica. And of course, coordination of 4-5 committees together. That is how Foxy Fellowship works. And lastly, I thank all the participants for joining us and making this session so interactive and meaningful. Let us come together and let us continue to spread awareness and secure future healthier generation through vaccination. Thank you all.
Thank you very much.
Thank you, everyone who has joined us live and is listening live to us.
Thank you, Dr.
our
Pavan, sir.
Thank you, our esteemed speakers.
Thank you, Sarita.
Yeah.
Thank you.
Thank you, Foxy and
Thank you,
Amox.
everyone. Thank you.
Yes,
It was a very
You,
great
Aman,
session.
Thank you,
Congratulations.
Amox and Foxy leadership, both for
Congratulations.
allowing us to conduct this session.
Yes. Congratulations. Thank you.
ma'am.
Good day ahead.
Thank you.
Good
Thank
day.
you, everyone.
We
Thank
can
you.
go offline,
Bye-bye.
please. Stop
Yes.
recording and go offline. Yeah. So now we can speak, sir.